Welcome to the October edition of the Monthly Dose. I'm your host, Rayah Hammad, and in today's episode, we recognize October as National Breast Cancer Month. Therefore, we are raising awareness and educating individuals about breast cancer this October and throughout the year. The National Breast Cancer Awareness Month is a collaboration of national public services organizations, professional medical associations, and government agencies working together to promote breast cancer awareness. It is estimated that 50% of women diagnosed with breast cancer have identifiable risk factors besides age and gender. Certain hormonal reproductive factors, as well as lifestyle, diet, and environmental factors, are associated with increased breast cancer risk. Even in women with a high genetic risk for breast cancer, nutrition factors such as body weight and diet are powerful tools for reducing risk, and these factors are all within your control. There are some other basic elements that you should be aware of discussed in our upcoming interview.
Kind of just mentioned when I first started, the idea of a surgical breast specialist, a breast surgeon dedicated just to benign and malignant disease, was very new. There are very few fellowships across the country, and now it's commonplace. So as a result of that, over the last 2 decades, we've seen that we've got a lot of dedicated breast surgeons, and therefore we're seeing a lot more aesthetic results. We surgeons are committed, to kind of creating small hidden incisions and reconfiguring, reshaping the breast after lumpectomy so it still looks as normal as possible, and post-mastectomy reconstruction with implants and different flap techniques has also really evolved over the last 2 decades so that women can come out of their surgical experience feeling more intact inside their own skin, which is beautiful. On the radiation front for breast cancer treatment, we have genomics that's hit the field. So genomics is understanding the genome, the DNA mutations, and then the expressed genes by the tumor. So not by you. That is its own thing that we, draw your blood or spit and we can test your DNA for mutations such as BRCA that predispose you to cancer. I'm talking about the cancer itself, its genetics. And when you're able to interrogate it in different ways, you can more precisely personalize the treatments that you're offering. For example, when it comes to radiation and in situ cancer, stage 0, we massively overtreat 65% of all DCIS because it never would have invaded, never would have been threatening. So who is in that group? Like, whose DCIS really doesn't need to be like pounded with a big hammer? Maybe we can just like gently knock on it and get rid of it that way. So that's come into the field of radiation to find out who needs radiation or not. What's the exact benefit of that? And if you do need radiation, we've got these shorter, intense courses now that are really fun options for people. I mean, cancer's not fun, but if you've got it, let's make it as powerful as it can be. And that might include making some of this kind of intriguing. And so radiation doesn't have to hit the whole breast anymore. Sometimes you need to, but there are many, many women with early stage disease in whom I can put a little catheter and we just kind of nuke the area that's the high risk zone for recurrence. 96% of recurrences always happen within a centimeter of where the cancer was. So you don't necessarily need to be hitting the more remote sections of breast, causing tissue damage and side effects that can be lifelong in their like pain and loss of elasticity of the skin. So APPI, accelerated partial breast radiation, allows for that. And IORT, intraoperative radiation therapy. That's my favorite thing because it's so cool. You do a lumpectomy and then you wrap that lumpectomy site in a balloon and the patient gets radiated for 12 minutes. And then I take the balloon out and then aesthetically close everything back together and you are done. One and done. It's all happened when you were sleeping. So I love IORT. On the oncology front, with chemotherapy and anti-estrogen therapy, which is commonly used still, of course, to treat cancer, that's also become more of a precision medicine thing with the genomics that I mentioned, different way to interrogate that cancer's DNA to find out what the percent chance that this bad boy is going to come back in a metastatic place like lung, liver, brain, bone in 10 years. If that number's high, maybe you're going to bite the chemo bullet because it's worth it. It can make that number lower for you. But if it's already low, you're just doing chemo to see what your head looks like bald. Like, don't do it, right? And there's no loss of survival points for you. So that's a beautiful advance. Genomics, the most commonly used ones are called Oncotype DX and Mammoprint, but there are several others commercially available. And really empowers women to make that choice without feeling that they're sacrificing survival points. There's also, of course, more drugs that have been developed in the last 20 years that are effectively treating breast cancer and lending themselves to higher cure rates. Our cure rates go up year after year. Mortality goes down approximately 2.2% per year over the last 2 decades, which is a great thing. You asked about the horizon. I think what's coming is certainly immunotherapy, where you are able to create your body's own ability to seek and destroy cancer cells and to take them out of you, right? They're already sensitized to the cancer that you had, and you amplify them like a bajillion times and then give them back to the person. So now they've got this massive army that's like marching straight after these exact cancers. Immunotherapy is already in the works, and then you do that with medications that potentiate your immune system's ability to seek out those rogue killers. And we continue to develop more what's termed biologically targeted agents, it's drugs that are better able to disable a cancer's weaponry, because it comes after you on multiple levels, cancer does. And so the more ways that we can then get after it, the better. On my horizon, however, is the elimination of disease by focusing on causation. Everything I've talked about right now is a Band-Aid. It never once addresses the root cause of why this woman got breast cancer in the first place. Because if you could get after that, uproot that horrible weed and get rid of it, you're getting rid of recurrence potential. You're getting rid of dying from this cancer. If you could stop it from ever starting, but it's already happened, now you can teach someone dietary and lifestyle intervention and transform their world. And that's my focus. And I do think it's going to take a minute, but the world is going to be pushed to shift what they're looking at in terms of health by, honestly, planet destruction and climate change is going to push you to be more mindful of your own health. And in so doing, I think we're going to see a huge drop in cancer over the next 20 years. I would love to talk about it. So the powwow is fun. It's a podcast where I interview patients and really bring out their stories of resilience and how they've been transformed by the journey into a person that's more whole, more purposeful with their living. And it's really inspirational. So we've also got health warriors in the field who are instrumental in affecting positive change through whatever their field might be. So I have like a medical oncologist or a general doctor, researchers, therapists, dietitians, and get their perspective. But everybody's kind of, the patients have their visionary stories that are beautiful, but then the leaders in the field are really aligned with my dietary and lifestyle philosophies of more preventive type medicine. I never really use the word, I never say you can prevent cancer, because you can't, but you can maximally reduce your risk. And that's my goal every time I talk.
Sure. Yeah. Okay. You're also hosting a Cancer Kicking Summit. What are some of the topics at that conference, and who's your intended audience?
This is so fun. So this summit represents the culmination of everything I've learned in my 25 plus year career as a surgeon, a physician and surgeon. And distill all of the science down into actionable power that will transform your life. The target audience is truly every person who is interested in living her or his best life. Although I do have, it's a little bit more geared toward women because my springboard is breast, but the summit is not about breast cancer. It's called the Cancer Kicking Summit because if you're able to kick cancer, man, you've kicked it all those major killers, heart disease, stroke, diabetes, Alzheimer's, obesity, they're all after you. And the same thing that gets after reducing cancer risk will reduce all of your major killer risks. And men have all of those too. But I use the kind of springboard of breast because, I'm a breast girl. So I do talk about that, but not in specifics at all. So the conference is all about taking control of what you eat and don't eat, what you think and don't think, what you do and don't do. And I get down and dirty with this orchard of life. I have 10 trees that I want you to plant in your orchard to live the most fruitful, bountiful existence possible. And I go into the science with each one of those trees. It's in a very fun and informative way that inspires you to be like, you know what? I'm going to give meditation a try. I didn't realize that fasting could literally give me an entirely replenished, rejuvenated army of immune cells in my body. I'm after that one. Or I didn't realize that my thoughts were holding me back from living my best life. I didn't realize I told myself facts that aren't true. I'm a smoker. Oh, you are? Okay, then you're never going to quit because then you won't be you because you are a smoker, I guess. You defined yourself that way. So we get into metacognition, thinking about thinking, a lot about eating and fasting and moving. Those are pillars of health change, is to not be sedentary, and how do you move and what exercises and what does that look like in a life that's a cancer kicking life, and then how to eat, what to eat, when not to eat. It's really fun. It's so it's online, it's virtual. You can download it now and start watching. It's 12 to 15 hours. The entire virtual summit is available for 90 days when you buy it. And then the live summit is so cool. It's at Terranea, which is an oceanfront resort in California in Palos Verdes.
Wow.
It's breathtaking, and you can come to that. Just check the website, pinklotus.com/summit for the next dates. We do, in the interest of keeping it evergreen, it's always happening soon. So check out when the next one is. And if you can't wait, you can always do the virtual summit. Please join. There's a couple of amazing things that I've got going on that I'd love for you to be a part of. One of them is called Power Up. The other is Breast Buddies. So Pink Lotus Power Up and Breast Buddies, entirely free. Power Up is an online social network for all women who are interested in being healthy. And it's more than a social network. That's just one part of it. We've got blogs and recipes in the powwow and my kitchen, and just have a look around. There's a lot going on. You can post breast list, for example. You could post your gently used wigs, scarves, hats, and you can buy, sell, trade them. It's kind of like, Craigslist for stuff. And we've got breast groups where you can go in and chat like anybody else on tamoxifen and hate it, and just really get into some of the more private aspects of treatment and what you're going through in life. Breast Buddies pairs women age for age, stage for stage, treatment for treatment with those who have been there, done that. That's a really beautiful thing. So Power Up is for every woman. We've got about 50,000 members now, and we've got about 5,000 in Breast Buddies, which I'd love to see. It's international, again, totally free. So you can be newly diagnosed and you need a buddy, or you can be one of the been there, done that ladies, and you can become a buddy and you get paired. So if you put in like I'm 52 and need a mastectomy and chemo, and all these people pop up that fit that, but she has a 12 or 15-year-old, and you're like, oh, so do I want to talk to her, then you can reach out specifically. And it's a really sacred sisterhood of friendship and support solely for the purposes of that. There's no other motives behind it. It's just connecting women with each other. And then finally, I encourage everybody to check out Pink Lotus Elements, which is the store I mentioned that is just chock full of really helpful products before, during, and after a diagnosis to help with risk reduction, with symptom management, improving comfort, and just overall making your life better.
Since its inception more than 25 years ago, National Breast Cancer Awareness Month has been at the front line of promoting awareness for breast cancer issues. Although a great many strides have been made in breast cancer awareness and treatment, there remains much to be accomplished. We encourage you to regularly visit these sites to learn more about breast cancer, breast health, and the latest research developments. You can find more detailed information at the link listed below. That was it for this episode. I'm Rayah Hammad. See you next time.